Karibu tena mtazamaji, tulikuwa tunazungumzia ugonjwa wa selimundu au sickle cell anemia, na nimekuuliza ukiwapo nyumbani, je, unafahamu nini kuhusu sickle cell anemia? Unaweza tuma ujumbe wako mfupi pale Facebook @elsamtv Kenya au tupigie simu kwa nambari 0721695384. Na tukiendelea na mjadala wetu wa leo, daktari, naomba utueleze complications zipi ama madhara yapi yatajitokeza mtu akiwa na sickle cell anemia?
Okay, so I'll handle these complications based on the body systems. So nitaanza na central nervous system, which is the brain.
Yeah.
The complications that can come in the brain is when we have what is known as stroke. Wale watu ambao wako na sickle cell disease, in case the sickle cells accumulate kwa brain, what will come is the ischemic stroke. When the brain lacks oxygen, we know as ischemic stroke. When there is a rupture of a blood vessel in the brain, we know as hemorrhagic stroke. But these people normally suffer from ischemic stroke. Sawa sawa. So when we come to respiratory system, which is the chest, these people might have the difficulty in breathing. What I told you before, what we know as dyspnea, gasping, yeah, and they can have pulmonary hypertension, which I said. So the blood vessels that normally take the blood from the heart to the lungs. So pulmonary hypertension, that is a severe complication and it can lead to death. When we come to the abdomen, that is a gastrointestinal system, they might have the abdominal abscess. We might have even the spleen, what we know as a sequestration crisis of the spleen. And the end result, when we have a sequestration of the spleen, it will result in known as a autosplenectomy. So what happens is the spleen will no longer work. Inakuwa vestigial. Yeah. So in this situation, these people will be vulnerable to infections. Such as Salmonella typhimurium, that is a bacteria that causes typhoid. We will have Streptococcus pneumonia, which will cause the infection of the chest sana. And that is why mtoto akiwa between akishaanza kupresent with these symptoms, before afike miaka 5, you should be covering this baby with antibiotics. So inapaswa akule penicillin every day mpaka afikishe miaka 5 to avoid that infection za hiyo bacteria. Pia Haemophilus influenza inaweza kuwa hapo, Moraxella catarrhalis inaweza cause hiyo infection. So when we come to genitourinary tract, so it's like the kidneys, they may have what we know as a pyelonephritis. Yeah, it can even cause kidney failure. It can even affect, so even these people, when they are passing urine, sometimes they can pass urine with blood, or the urine fails to be concentrated. When we come to the reproductive system, there's a situation known as priapism. This is a very painful erection that cannot stop for even 2 hours to 4 hours. Yeah, and this situation, these people normally need to be managed in an emergency department when they have this situation. When we come to integumentary system, that is the skin, they might have leg ulcers, sana. They might have what you know as hand-foot syndrome, that is like dactylitis. Huko kwa mikono ukiwaona wamefura, extremities uko chini wamefura. And mainly the cause is anywhere in those body systems is there's accumulation of that sickle cells and it is blocking the blood flow. Yeah, and these people are now feeling pain, and at the same time they are presenting with swelling in some situation. So that is exactly what happens, and those are the complications based on the systems of the body. Yeah. And
how does it affect men and women?
I cannot say it affects more men than women. It's generally, it's like it affects both genders at the same time. But sana wanaume will present with these severe symptoms than women. Reason being, they are still doing the studies. But if it is about the infection they can get, because if your mother has the sickle cell trait, your father has the sickle cell trait, the chances of you having sickle cell anemia is 25%. It is equal, whether you are a male or a female, it will be the same. Yeah.
Na changamoto zipi ambazo watu ambao wanaugua sickle cell hupitia?
So, for instance, this pain it is very sudden pain. We might be talking with you right now, then all of a sudden I'm having sickle cell crisis. Sana people feel like they are being discriminated, or they are being looked like they are pretending, and that is not the case. The onset of the pain is sudden, and even the end of the pain will be sudden as well. So sana wanaonaga hizo vitu is like wanapitiaga nini hizo discrimination and stuff. The other thing is in the work they are doing, they are limited. What happens is they cannot do heavy work. So they only need a office work. And sana even in Kenya, going by statistics, not all the people will be working in offices. It's like sana ni zile manual work, and these people will be limited to work there, so hawezi fanya kazi huko. That is the situation. So even ku-interact na watu wengine, it's like when they do exercises and stuff, when they do extreme exercises, what happens is they'll be having that sickle cell crisis, because it's like when there is exertion, there is need for more oxygen, and the body cannot handle less oxygen. Sickle cell crisis comes in.
And take us through the treatment and
So treatment, I will start with the only cure that can cure sickle cell disease, what we know as stem cell transplant. So it's known as hematopoietic stem cell transplant. It is very risky, and even getting a donor specific match for you to be, so that they can transplant the stem cells in the bone marrow, is very difficult. But once that thing goes through, you will be able to be cured from sickle cell disease. So that is the only cure that is there. We will have the management now of the sickle cell, the hemoglobin itself, and then we will go to the management of the pain side. So for the management of the disease, we will have also the medication. We have a certain medication known as hydroxyurea. Hydroxyurea is a very effective medicine for sickle cell anemia. What happens is it is going to treat the abnormalities in the hemoglobin. The other thing is it is going to facilitate the occlusion. When there is occlusion of the leukocytes with the platelets, the red blood cells, at the same time it is going to clog the blood vessels. So the purpose of this medicine is to prevent that occlusion. We will have a certain drug known as L-glutamine powder. It is oral. L-glutamine powder, the purpose is to facilitate, to prevent the hemoglobin itself, the hemoglobin abnormality itself.